How do you know if you're having real contractions or Braxton Hicks contractions? Hi, I'm Nurse Carly, and this is your go-to resource for everything pregnancy, birth, postpartum, and baby care. What are Braxton Hicks contractions anyway? If you haven't heard this term before, Braxton Hicks is the name that's given to basically fake contractions. This is something that can happen starting as early as your second trimester. And this is actually the body's way of kind of practicing labor. Your uterus is a muscle, and just like any muscle in your body, it needs to get stronger and practice what it's supposed to do. So your uterus may do some fake contractions every once in a while to help your body start preparing for the process of labor. Real labor contractions have a different purpose. They're not practice for the uterus, but instead they're actually helping to thin and dilate your cervix, which is the place where the baby is going to pass through when you give birth. This is why real labor contractions are so much more painful than Braxton Hicks, because they have a different purpose, which is really way more intense. Some women experience Braxton Hicks contractions for a long time throughout their pregnancy. Some women don't have them at all. But the biggest question I always hear is, how can I tell if I'm having real contractions or if these are just more Braxton Hicks as I'm later in my pregnancy? This is always super concerning because, of course, in that third trimester, you're always on the lookout for the first signs of labor. So there's a couple key differences between Braxton Hicks contractions and real contractions. Braxton Hicks will typically come and go. There's no regularity to them. So what that means is if you get up and take a walk, or if you lay down for a little while, if you drink a bunch of water, these are all things that can sometimes help the Braxton Hicks to kind of ease up and go away. Real contractions don't really go away. If you're in labor, your contractions may start out slow, not for everyone, but for most people, they start out a little bit slower, a little uncomfortable, but not too intense. And the thing about real contractions is that the intensity grows over time. So that's the biggest difference between Braxton Hicks and real contractions, is the intensity. Braxton Hicks will be a little uncomfortable, but a real contraction is going to start getting painful at a certain point. The other thing is the length is usually different. For Braxton Hicks, they're a little bit shorter, and a real contraction usually starts to take about a minute from start to finish. So if you are experiencing any type of contraction, it's always a good idea to start tracking it and use a timer in your phone. I have an app that I use that I really like. And you want to time those contractions so that you can start to see if a pattern is developing. Are they coming regularly, and are they lasting for at least a minute? A little tip that a lot of providers will give their patients is called either 511 or 411. This means you should head to the hospital if your contractions are coming every 5 minutes, lasting at least 1 minute for at least 1 hour. Some providers prefer the 411, so that would mean your contractions are coming every 4 minutes, lasting for 1 minute, and this is happening for at least 1 hour. So that again reinforces the idea that a real contraction has a consistent pattern. If you're not sure if you're in labor or if you're having real contractions, it's a great idea to call your provider and see what they would like you to do. Or you can head to the hospital that you plan to deliver so that they can monitor you and baby and see if they can pick up any consistency or regularity to your contractions. They can also check to see if you are dilated, which would be a sign that you may be in the beginning stages of labor. I hope this information is helpful. Don't forget to like and subscribe. Thanks for watching.